What role do parents have when you're working with an anxious child?
So I tend to see this, and I'm not alone in this, as a family problem. So the rule in my office is, and this surprises some people, and I talk to therapists about this a lot, the rule in my office is that if you can drive to your appointment by yourself, you can come to your appointment by yourself. So I don't always have the parents in the room every minute of the appointment, but the younger the child, the more the parents are involved. It truly makes no sense to me, knowing the connection between anxiety and family members. It doesn't make any sense to me to work with an 8-year-old or a 10-year-old or a 12-year-old or a 6-year-old and not have the parents getting the same information. So I'll often meet, the younger the child, I may not even meet with the child at all. I'm really working with the parents.
Okay.
Yeah.
Do you usually find that there's a relationship between anxious parents and anxious children? Is that
Yes.
a learned behavior? Or?
Well, there's a lot of modeling going on. So one of the things that I say when I'm working with parents and I'm doing a parenting presentation, I'll say, look, when it comes to anxiety in families, the thing is, if it's nature, it's you. If it's nurture, it's you. And we all just sort of have to accept that. So giving parents the tools and giving them the support and giving them the coaching to interrupt their patterns is essential in helping an anxious child. So they need a lot of support. Modeling, we know there's some good research out there that shows that genetics certainly provides a push, and we know that behavioral inhibited temperaments are genetically mediated, for example. We know that OCD has a pretty strong genetic push behind it, but it doesn't mean that that's the only reason that a child becomes anxious, nor is it a predictor that they'll stay anxious. So we really want to get in there with the family and support them as much as we can.
Great. Okay. Do you find that most therapists who work with children often make that mistake? They work with the child first, they don't involve the parents. Is that something you typically...
Well, I wouldn't say that they typically exclude the parents completely, but I will tell you that when parents come to see me, and oftentimes they've seen other therapists and maybe are still in treatment because I'm doing a consult, and the biggest complaint that parents have for me about therapists and about therapy in general is nobody told us what to do. So they really are looking for information. Never in the history of psychotherapy has an 8-year-old come out of a session and said to the parents in the car on the way home, you know what, Lynn just did this great cognitive restructuring exercise, and so let me explain to you how it goes. And then the 8-year-old doesn't say, and when we get home, let me see if I can help us all implement it. So it just doesn't make sense to me why you give the information to the 8-year-old and you don't include the parents. It happens a lot, for sure. Yeah.